Hello, everybody. This is the Bamboo Garden Wellness Center podcast. My name is Dr. Richard Jelusich, and this is Dr. Michelle Dexter. We're the co-owners. And today we're going to give you an interview of me on integrative chakra therapy.
So thank you, Richard.
Thank you. It's good for us to be here.
So having said that, I think today that we'd like to discuss three things. Number one, what is integrative chakra therapy? Number two, what is its history and origins? And number three, and perhaps the most exciting part, what is dominant chakra theory?
Okay. Well, integrative chakra theory, um, or rather therapy, came about many, many years ago. In the earliest part of the 90s, I was studying and researching the chakra system, both as an intuitive spiritual counselor. I was an ordained spiritualist medicine reverend, and also undertaking studies at the California Institute for Human Science, a graduate school and research center into the mind, body, spirit. And so I started to with my clients, notice some similarities in the chakra system. And I stayed away from studying other people's work just so I could kind of develop my own idea of how the chakras actually function beyond just centers of energy. I found them to be centers of consciousness that regulate and affect what I call the four archetypes of the whole human being. That is not just the physical body, but mental, spiritual, and emotional states of being. So that went on, and I started noticing similarities and differences, how certain chakras could have higher and lower aspects, how the chakras each had one or more specific intuitive abilities, and that in my understanding, the chakras are beyond space and time, therefore open 24/7, which to me meant that a person would be intuitive regardless because they have chakras, the chakras are open, the chakras are centers of consciousness, and therefore all of our intuitive faculties are open and functioning. It's just that they're not really cultivated in a lot of people. That's changing today, thankfully. And so the history of it is I started to think about how I might teach individuals how to do a form of healing work, or as it's popularly called today, energy medicine, energy psychology. So, because I was trained in how to allow energy to flow through me, I was working on the level of the chakra system, which allowed me to help see not just the condition of the chakras, but the actual character of the person themselves in this lifetime, their strength, their weaknesses, their challenges, their infirmities, and so forth, both in the body and in much deeper, more subtle energy realms. So, this led to a how I would notice that a person could have one chakra that might be more prominent than the others. This led to a theory called dominant chakra theory, where I would intuit a person's particular chakra as being a little bit more prominent than the others. It's a lot like calling a person right-handed or left-handed. There's nothing wrong at all with the non-dominant hand. It functions just fine. It's just not the one that's used as much. So for instance, if a person were to be, let's say, heart chakra dominant, of the seven chakras, that maybe this one, the heart chakra, was more prominent. Well, the others are working just fine, but they might tend to be a little bit more empathic, a little bit more assuming the potential pureness or love of all creation. And intuitive abilities don't just work with people, it works with plants, animals, anything at all, events, circumstances. So I started codifying these dominant chakra traits into a book called Eye of the Lotus Psychology of the Chakras, which was published in the early 2000s. And it is a kind of a compendium on my definition, my perspective of how the chakras work, how a certain chakra can have a higher and a lower aspect to it, in other words, whether it's functioning well or not, and how a chakra can be more prominent or dominant than the others. So a lot of times I get asked the question, is a person's chakra, a particular chakra, dominant for life. So my understanding from what I've seen for over 34 years of doing this work is yes, a person's dominant chakra tends to stay that way for a given lifetime. However, a person can have issues and challenges in any chakra at any time, regardless of which one is dominant. So how am I doing on answering your question so far?
You did. Now I have a few questions for you.
Sure.
So when you talk about a chakra being a center of consciousness, I'm sure that many of our listeners know that chakras are energy centers and that there are considered to be 7 of these major energy centers in the body,
Mhm.
starting at the root and roughly the belly, roughly the solar plexus, the heart, the throat, the third eye, and the
Crown.
crown.
Mhm.
And so when you say it's a center of consciousness, does that mean that it's an information field? Does that mean something else? Will you say more about that?
Well, to me, the aspect of consciousness that we experience in our physical reality comes down to 4 parts. The physical body, everybody gets that, but also the mental processes, the emotional state, but also the spiritual state. And the spiritual state is probably the least understood. And so it goes back to what are called the Vedas, a system of writings about 3,700 years ago that sought to help define the energy system of the human being, the chakra system of the human being. And so what was written was that there are 3 yoga bodies or 3 levels of dimensions. The physical dimension, obviously, we know that very clearly, where you have a physical body and a physical mind. But the next dimension, called the astral dimension, is a dimension beyond time and space. But you still have an astral body and an astral mind. They're still male and female, although maybe perhaps a little less so. And there's an even dimension above that that's even finer called the causal dimension, which is also a dimension beyond space and time, where there is also a causal body and causal mind. But in each of these 2 higher dimensions, there's no internal glands or organs, but there is some form of energy distribution system that maintains the uniqueness of that person in these higher dimensions. So right there, there's irony. And this is where a lot of people put on the brakes is when we have a physical identity, we can see that very clearly. But to say that a person has an identity or a personality in the astral or causal dimensions is a little bit more difficult because these are dimensions beyond space and time, and yet there's uniqueness. And yet this is what was written about. So therefore, consciousness that exists in higher dimensions, not limited to space or time, is much more expansive and yet still related to the personality. So as a person begins to use their chakras, let's say you engage in some form of spiritual practices, or you see someone like myself who facilitates energy medicine, energy psychology, it actually helps to increase the merging of these higher dimensions with the physical dimension, because there are those who say that perhaps, we ascend out of the body to higher dimensions, or the soul in the higher dimensions comes into the body. But actually, it would be more accurate to say that the consciousness of these 3 dimensions, as you start to awaken yourself, collapses. It actually collapses so that you actually become more and more aware of higher orders of being beyond 5 sense perception. So that's the idea of consciousness. And that as we employ our dominant chakra, we tend to see through the filter or the lens of what that dominant chakra represents. But as we seek our own path of spirituality, whether it's prayer, meditation, yoga philosophy, yoga practices, we begin to engage the stimulation of our chakras. So my practitioners are taught to use their chakras to assess the people that they're working with, but also to allow what I call divine energy to flow through them, not from them, to flow through them as a conduit to help that person to attain a better sense of their own perspective in life, why they see things through their dominant chakra and how it affects their perceptions in reality, and how it affects those 4 archetypes in helping them to heal and rise to higher levels of awareness.
Okay, so let's go back to 2 things. So you gave an example of what it might be to be a dominant heart chakra.
Mhm.
So number 1, how would you know based on anything what your alleged dominant chakra is? And could you give an example of what it might look like to be dominant in all of the seven chakras except for the heart, because you mentioned that one.
How would I know?
Yeah, how would you know?
My intuitive faculties.
Okay, but how would a person on the street know?
How would a person on the street know about their own
Well,
dominant chakra?
well, perhaps I didn't word that well.
Well, that's okay.
All right, so let's say that somebody comes in off the street and buys your book,
Yeah.
and now they've read about dominant chakra
Mhm.
theory,
Mhm.
and they've read maybe some examples,
Mhm.
and they're thinking to themselves, I wonder which is
Oh,
my
yeah.
dominant chakra.
Mhm.
So how would they know?
Well, sometimes when they read the book for the first time, they think, oh, I'm a little bit of that, and I'm a little bit of that, and I'm a little bit of that. Well, there's really no seam between the chakras. There's no boundary or border between them. All seven are working together. But you may have what the Buddhists call a proclivity to be in one chakra. So in my second book, called I Can Relate How We Intuitively Choose the People in Our Lives, is a checklist that goes down through the different chakra characteristics. And by doing that, you can at least get a rough idea of what may be your dominant chakra. In addition, there's 27 case histories in that book to give an idea of how people with different dominant chakras work with each other based on these intuitive faculties, where one may be a little bit more dominant than the other. So it's very exciting for me because you can see the results in people that whose eyes are open to say, okay, so maybe that's why I see things the way I am. I have this chakra as dominant. So in my theory, chakras one, which is at the root of your spine or where your legs come together at the perineum, is more about being grounded onto the earth plane. To me, it's not really affecting our cognitive waking ability so much as it is just like, I'm here, I have a physical body, I'm on earth, I'm grounded. This is the denseness of this dimension. The second chakra, which is the one just below your navel, is called the sacral chakra. And its main psychic ability is called the energy of the mystic. Now, these are terms that I've labeled. They're not written anywhere else. It's just my interpretations. But what it means is the intuitive faculty to tend to observe the potential in a person, place, or thing. And so remember, all chakras are open, all chakras are functioning, all of the psychic abilities are functioning in all people all the time. So the second chakra is really about creativity, it's about responsibility, it's about burdens, it's about relationships, but in a single word, it's about creativity. But the psychic ability flowing through the second chakra is the ability to perceive certain things like a person, a place, a thing, how it could be as whole and complete. So that chapter in the book is over 5,000 words longer than any other chapter because most of us, whether our second chakra is dominant or not, are processing a lot of second chakra stuff, self-validation, self-worth, abandonment, abuse, abundance, all that stuff can really be second chakra. Also because the second chakra is more connected to the five sense perceptions than any other chakra. Now, the third chakra is the solar plexus, and that is mostly a psychic ability called incisiveness, which means get to the point. What's the bottom line? Who's the guy behind the curtain? And remember, these are active all the time. And so that particular intuitive faculty allows you to help see things as they are. And so when I talk about consciousness, each chakra also flows through lessons and experiences to overcome infirmities and traumas and tribulations and trials in life as a center of consciousness, coming from higher levels of our being and manifesting in this dimension. So you might not think my chakra is actually showing me what to do, how to overcome this challenge. So the fourth chakra we covered is mostly about empathy, which is the ability to perceive the depth and the profundity of that which love is. And I use the words purity and love interchangeably. But the chakras do have other abilities, but these are the main abilities. The throat chakra, which of course you know is right here, has to do with a quality called telepathy. Now, many feel that telepathy means I'm reading your brain, but it would be more accurate to say to know that which is the character of a person, a place, or thing. So that is more comprehensive than just to be able to articulate only. So these abilities are present all the time. This one here is called the brow center, or popularly the third eye chakra. And its main ability is a kind of a clairsentience, which to me means to know that which cannot be known. It means you just know. And interestingly, the Sanskrit word for the brow chakra is ajna, which means command. So that's why a lot of people are concerned with awakening this chakra first, because even one of my main teachers would say, if you're going to awaken your chakras, it's probably better to awaken the brow chakra first, because it would give you deeper insights into the higher paradigms. So the psychic ability of the sixth chakra offers you the ability and the capacity to comprehend the new paradigm, the new truth, the new things that are becoming extent that nobody knows about. The seventh chakra is the crown of your head here. And similarly to the first chakra, in my research and consultations, it doesn't really affect the cognitive waking abilities as much as it's more like a kind of a gateway to much higher dimensional levels of awareness. Although it is important to balance and to continue to awaken all seven chakras.
Okay, so that gives us kind of a sense of what maybe a dominant chakra is doing in terms of your life or your personality. Now, my follow-up question is, so, okay, you talked about this integrative chakra therapy thing.
Mhm.
So if a person wants an integrative chakra therapy session, so you might have them lie down on a massage table and you do your thing. Now, what are you doing and what outcomes should they expect?
And it doesn't have to be laying down on the table, and it doesn't have to, I mean, oftentimes it's just sitting across from me in a session, or oftentimes it's just sitting across on the other side of the laptop because I have clients all over the world. So, this type of work that I do and my practitioners do is non-local. The distance is no factor in this work. So, a typical session would be approximately 50 minutes. And there's a little bit of discussion that goes on, because in actually facilitating this person's self-healing, because that's all the person really is doing, is healing themselves. And we as healers are only conduits. There needs to also be a level of discussion to where I'm explaining to that person which chakra may be dominant, which other chakras are involved, what are the higher and lower aspects, but why is that important? So yes, the actual healing work does happen, but also there's a discussion. So the person has cognitive tools that they can use to say, okay, I tend to see things this way. Here's what's going on and why. Here's what I can do about it. And here's how to go and do it. So the premise there is empowerment of the individual. So typically, yes, a session might be about 50 minutes in person or non-locally, but that is the essence of it. And usually, for me, I have found it important to record these sessions because I cover a lot of material in one session, and that there is the possibility that the person can not only garner more information, but when you play the session back, it tends to reconstitute and reinforce all of the energies of that session, and the person tends to go through self-healing again.
So why might a person seek out integrative chakra therapy?
Simply because it's a lot like a popular term we use nowadays called functional medicine, which is oriented towards what is the root cause of why there is an infirmity. Could it be a past life? Could it be a trauma in this lifetime? Could it be some issue that has remained for lack of insight or for lack of healing? And the thing about doing this work on the level of the chakras is incredibly transformative. I have many testimonials from individuals who have healed both physically but also spiritually, gaining much deeper, much greater insights. So this is a motivation that a person would have to come in and see me for what I do, is because these transformative changes, while I insist are actually done by the person themselves, and we're only conduits, but for me, having been in this work for 34 years and taught so many practitioners, it's very rewarding to see the person make such dramatic shifts in their own healing.
Indeed. Indeed. Do you have any case examples that stand out in your mind?
I have one that you and I were talking about just the other day. There was this fellow that he had been diagnosed with a heart issue, and he decided to come and see me. So when I enter into a spiritual consultation with somebody, I look to see what is the origin of that problem. And basically, I told him what it was, where it came from, why it was there, and what he could do about it. But at the same time, we did energy medicine. We did integrative chakra therapy. And later, I think it might have been 2 months later, he went to a healthcare professional, and his heart problem, which had been diagnosed as potentially mortal or lethal, had completely disappeared out of his body. Completely disappeared. So remember, people are just healing themselves, but we're living in an era where you and I are supposed to know that this reality exists, that we have these powers that can come through us to help facilitate healing for each other.
Indeed. So what would you like the world to know about integrative chakra therapy?
I think we're living in an age called the age of truth revealed. Some people also call it the golden era of inner transformation. And when you look at some of the ancient texts and teachings from people, whether they were the Mayans or the Hindus and so forth, they talk about an era that we would live in, this era now today, where we have the capacity and the capability to heal on a much deeper level than just only our bodies. That it was intended that we know that there really is a mind, body, spirit essence to ourselves, that there really is a dual nature in that we do have these physical presences, but we also have a spiritual presence, like two sides of one coin that is still functional. But we live in an age where it is now more extent to be able to integrate those two aspects of our being, the physical and the non-physical, as one. Why? Because then it would help you to see things more as they are than as they appear to be. It would help you to live a much more empowered life because you would know why you have a perception and a perspective the way you do, why you react and respond to certain life situations the way you do. And with that level of awareness, you can make better choices. And with better choices come better perceptions and better responses, which gains in a higher level of awareness. And we call this an evolutionary spiral. With higher levels of awareness, you make better choices, and better choices. So that is why a person would be compelled to come and see someone like me for what I do.
So in a nutshell, integrative chakra therapy is not only for physical ailments, but it's also for the mental, the emotional, the psycho-spiritual, like you said, the four archetypes of the whole human. So any domain could be treated by ICT. Is that right?
Yes. And as I said, the spiritual is probably the least understood. If we were reading about a yogi or a guru or a swami who did what they call a transmission, which would uplift the devotee or the disciple or the seeker to a higher level of spiritual awareness, that's ICT. So the humor is I'm getting too old to pull my punches anymore. I've been doing this for so many years, over 34 years, that I know what can happen with a person spiritually when they see someone like me. And I say that with humility in my heart. But then again, I have so many cases where people have changed a lot in their lives and have awakened to a higher level of being. So again, I'm going to say this probably for the third time. You're just healing yourself.
Mhm.
Healers are only conduits for your own self-empowerment. You already have a divine blueprint. All you're doing is accessing what you already are.
It's beautiful. I would call that co-creative. Would you agree?
Yeah, I call it a co-creative conscious collaboration where as spirits, we're always working together. Like if there's a time when you see this podcast and you say, well, I might like to try that out. But on some level, your spirit said, okay, I'm going to find a Dr. J, a Dr. Dexter. I'm going to find the Bamboo Garden Wellness Center, 25 practitioners and partake. That is the eloquence and the sublime beauty of our spirits working ceaselessly behind the scenes to co-create the externalization of material events where we're led to certain situations that advance us, that have the possibility to awaken us. And that's the cool thing about living in this age, is we all now have the capacity to be able to do this.
Indeed. Any final thoughts on who would be well benefited by integrative chakra therapy?
Well, I think pretty much anyone. I mean, I did mention past lives, and I've been teaching and counseling past lives since I think 1994. That's a reality. So, the thing is to take the hype and the fascination and the phenomenalism out of metaphysics and to help us realize that we really are spiritual beings with a physical existence. And it's a very beautiful thing. It's not anything to be scared of. It's just that sometimes it's hard to wrap your mind around how you can be a spirit and physical in the same moment. And yet, that's exactly who we are.
Right. So I'd like to bring up one more thing.
Sure.
You mentioned energy medicine and energy psychology,
Mhm.
and there's quite a lot of overlap between them, but
Mhm.
there's also a very important distinction that I think is apropos to this conversation. So, energy psychology is all about getting into narrative and hearing the story about things, whereas energy medicine is more passive. So, I like how one person summed it up as energy psychology is do with, and energy medicine is do to.
Mhm.
And so, the benefit of integrative chakra therapy being a do to is that you simply get to sit in the chair or lay on the massage table, and the practitioner gets to do it to you, and you just get to relax. And so the healing is happening without you having to delve into painful discussions or, get into things that you don't want to talk about or relive. It's just, simply,
Mhm.
very relaxing. And so for the person who's not interested in having those types of conversations, then that's a real benefit.
And there is the narrative that goes along with it. As I
Yes.
said, in this type of modality, there is the discussion because, there are times when, for instance, a woman will come and I will say, well, how many children do you have? And she'll say, well, I have two children. And I'll say, well, where's the other two? Because I can see all the fetal spirits. So there has to also be a narrative that goes along because, a woman can do something a man cannot, right? To bring forth a life. And that's incredibly important. So that's why it has taken me many years to formulate how to teach my practitioners because I have ongoing school in ICT to teach practitioners how to do what I do to give that narrative to be able to help the person empower themselves, which leads to if a person comes for a private session, why it's recorded. So then they have that narrative and they can do that with the energy medicine to get both sides of the coin, the cognitive understanding, but also the inner spiritual shifts that take place.
Beautiful. Any final thoughts?
No, I think we about covered it. For the people that are watching our podcast, you're going to have a lot of questions. And so at the end, we always give you the ability to contact us with these questions, whether it's a phone call or an email or a visit to our websites. But the important thing is ask lots of questions. Ask me, ask Michelle, ask our practitioners so that you get deeper insights to truly help you empower your life because that's what we at Bamboo Garden Wellness Center are all about. We're here to help you empower yourself and live a productive, relevant, and meaningful life.
Indeed.
Thank you, everybody, for watching our podcast. This is episode 2, and there's more to come.
Yeah.
Thank you, everyone.